The other infection that's been completely eliminated worldwide is called Rinderpest. And it's a disease of cattle. So here, buffalo, cows, like those kind of animals. Sometimes they called it the cattle plague. It's related to measles in humans and distemper in animals. Like if you've worked in an animal shelter, sometimes dogs can get distemper. In populations that are called naive, meaning they haven't evolved with the virus, they've never seen it before, they have no immunity, it's nearly 100% fatal. And it's transmitted by contaminated air and water. The symptoms of the disease include fever, loss of appetite, diarrhea, and rash. And again, you're seeing this in animals, of course. Death is anywhere from 6 to 12 days after the onset of symptoms. And remember, it's nearly 100% fatal. So, here's a picture of a cow that has the infection. You can see like the stall is covered in feces. The cow has significant nasal discharge. And then out here, this is from the late 1800s, a field of all the cattle that have died of the infection. This type of infection is important for a couple of different reasons. One, it's economically important for these farmers, right? They've lost their entire herd of cattle. How do they make any money? How do they live? But cattle are also a source of food, whether or not they're, dairy cattle or meat cattle. Now you can't feed people, not just the family, but you can't feed anybody. So the economic and the agricultural importance of these animals really can't be understated. So it's really, really important that we don't have diseases circulating through the cattle. So a cattle plague, and maybe it was Rinderpest, we don't know, was thought to be one of the plagues of Egypt described in the Bible, right? All the cattle all of a sudden dropped dead. Like, well, 2,000-3,000 years ago, you're like, well, God must be pretty ticked off at us. He killed all our cows. You don't think, oh, well, it's probably some kind of virus that's circulating in the air or water. You're like, oh, yeah, no, God killed our cows. That totally makes sense because they all just dropped dead of a horrible disease. In the 1800s, the idea was if you wanted to stop it from spreading through your herd, you would slaughter all of the infected and any cattle that had been exposed so that you could keep the rest of your herd safe. And of course, that was very expensive. Obviously, very expensive because you're still losing all those cattle and you're doing the labor to go out there and kill them. And they still will do this now with poultry flocks. If avian flu gets into a flock of poultry, they'll just kill them all. And that's why egg prices went up really significantly within the past year or so. But I just saw the ad from Rayleigh's and it looks like the egg prices have gone back down again, which is great. But remember, it's expensive for the farmer. It's expensive for the consumer. It creates a lack of available food. And it's really sad that all of these animals died literally for no reason, except for that they got an infection. So, it's really important to stop these diseases. So the process of trying to inoculate the cattle, trying to use like a weakened form of the virus, just like you would do with variolation for smallpox, it was actually not successful in the cattle. And it actually maintained the virus in cattle populations. So instead of using this inoculation form, it was really important to develop a vaccine that would truly provide protection without putting the cattle at risk. So the first vaccine was developed in the 1960s, and it's what we call a live attenuated vaccine. And it worked okay. So live attenuated means that the virus can still replicate, but it's not good at causing disease. And we have a lot of vaccines that are like this. For example, our measles vaccine is like this. And this is really helpful because it is a virus that's capable of replicating, but it can't really cause significant disease in most patients. So you mount a really great immune response with very low risk. The next vaccine was taking the cowpox virus. So the cowpox virus is really similar to the smallpox virus. They're both in the same family. Remember, the cowpox virus is what we use to vaccinate against smallpox. But hopefully you're thinking, well, cowpox and measles are not the same, right? Measles is a totally different virus from cowpox or smallpox. So how does that provide protection? Well, they did what's called genetic engineering, and they modified the cowpox virus and made it show Rinderpest virus proteins. So it's like a hybrid virus. It's cowpox, but it also shows Rinderpest. And that also was very effective. So both of these vaccines were very effective in protecting cattle from Rinderpest infection. So you could pick either one. In areas where farmers were doing a good job consistently vaccinating their herd, the vaccine worked really well. So remember, this was in the 1960s. In the 1980s, there was a massive outbreak of Rinderpest in Sudan. And unfortunately, that led to millions of cattle and other wildlife that are related to our domestic cattle that either were killed by the virus or had to be culled from the herd to prevent spreading in Africa. And again, think about the economic importance of these cattle, the food, right, for the people. Like, that's how important these cattle are. And the wildlife as well, how much that must have affected the ecosystem. People, of course, also hunt wildlife for food. So you've lost huge amounts of food sources, you've lost huge amounts of money. And because of that, the countries in Africa got together and developed the Pan-African Rinderpest campaign. And by the 1990s, so a decade later, 10 years, the majority of Africa was Rinderpest free, except for two countries, Sudan and Somalia. And the last confirmed case of Rinderpest was in Kenya in 2001. And the disease was declared eradicated in 2011. So they waited 10 years, like, are there any more infections, And then they finally said, you know what, this disease is gone. So 2001 was the last time this disease was ever seen on the planet. So about 50 years after the initial vaccine was developed, 1960 to 2001, and the disease is gone. And again, that has huge implications for a steady food supply and for the economic health of areas where this infection was common. So those smallpox and Rinderpest are the two diseases that have been completely eradicated. And there are programs in place to help eradicate other diseases. One of those diseases is polio. The majority of the world is considered polio-free, including the Americas, the Indo-West Pacific, Europe, the Western Pacific, and China, Southeast Asia, and India. In 2023, so far, as of August 23rd, that was the most recent data I could pull, there have been 12 wild cases of polio in the world. And I want to differentiate for just a minute, what is a wild case versus another case? So a wild case means that somebody was exposed to the actual virus and developed polio. And there are only two countries in the world that's had cases of polio that were wild this year, Afghanistan and Pakistan. That's it. These other, these ones in red. And apparently one in Mozambique. But that's okay. So 12 cases, Afghanistan, Pakistan, and Mozambique. These other cases that are in orange or in green were vaccine-acquired cases. So the vaccine that is given in these parts of the world that works the best is an oral vaccine, and it's alive attenuated. And every once in a while, it can revert and cause some disease. And so you usually get a few hundred cases every year of vaccine-derived polio. It's usually far more mild than wild polio, but it does happen. In fact, there was a person who had traveled to an endemic region and came back to New York and had developed a case of vaccine-derived polio, and they were detecting the polio virus in the sewage in New York, but nobody got infected, so that's good. But again, so this disease is almost completely eradicated from the wild, right? It would only be associated with vaccines, and so once there are no more naturally occurring infections in these areas, we would switch to the polio vaccine that we get in the US that is not capable of causing derived illness. So we also get vaccinated for polio in the US still. So these two countries, Afghanistan and Pakistan, are considered endemic, meaning it's still circulating there. Maybe this person from Mozambique traveled. I don't know. I don't know the history of the patient from Mozambique, but these are the two countries where it's considered to be still established. So pretty close to being gone. Another infection that people are working to eradicate is called guinea worm disease. Now this one is difficult because there is no vaccine against the infection, and there are no drugs to treat it once a patient has been infected. It's a disease that's transmitted through contaminated water. And so really the goal behind this eradication has been to treat that contaminated water, including like filtration and things like that. There are 180 countries that are considered completely disease-free. Some never had it. Some that did, it's been cleared away. In 2023, there have so far only been 6 cases in only 2 countries, Chad and Cameroon. In 2022, right, because we're not done with 2023, so I had to include the 2022 statistics. In 2022, there were only 13 cases in 3 countries, South Sudan, Ethiopia, and Chad. So, if we go back and look at a map of Africa, it's kind of centered in those regions. And those numbers are down from almost 3.5 million cases per year in 1986. So in under 40 years, we've gone from millions to a handful, right? And you can see that kind of trend here. So here they start in like 1989, where there were about 1 million cases in 1989, down to like, right, 13 in 2022. We'll see what the final numbers are for 2023. Okay, so this infection has no vaccine, no drug treatment. How do you get rid of the infection? Okay, so the infection is kind of gross, and I apologize for this, but not really, because it is killer microbes. That's kind of what happens in a class called Killer Microbes. It's a worm, a guinea worm disease, and it creates this lesion, and the worm actually kind of like sticks out of the lesion, and that's how it reproduces. It like releases its eggs and larvae into the water when you put this part of your body in the water. So the only way to really get rid of the worm is you wrap it around a stick. You can see looks like a match, but any kind of stick. And then you just, every day you slowly turn the stick, like just a little bit, because you don't want to break the worm. So you pull every day a little bit until you pull the worm out. And if you think of that, like the doctor's staff that looks like it has a little snake around it, they think that it's like representative of this. So super gross, but almost gone. So it's very likely that this infection will be eradicated in the next decade or so. So the life cycle is shown here. Let's start with, how do we get the infection? We drank unfiltered water. So one of the goals here is to get people in endemic areas, to get them water filtration devices. So there are some invertebrates in the water that have larvae of the parasite. When you drink the water in your stomach, eventually the invertebrates called copepods will die, but that releases the worms. And the worm larvae will burrow out of your stomach and intestine into your bloodstream. And then there's a male worm and a female worm. The female worm is this really long one, and the male worm is really small. That's just how it is with the worms, at least the ones that have 2 separate sexes. The males are usually pretty small and the females are pretty big, because they're basically reproducing factories. So the male will fertilize the female. The female will migrate to the surface of the skin like we see in this picture here, and that's where she releases her larvae. And it takes about a year from ingestion to like the worm popping out of your skin. So then, if you get into some water, you're infected, you get into some water to bathe, or maybe this is painful and the cool water helps it feel better. When you put your foot, let's say, in the water, that female worm then releases her larvae. The larvae are consumed by the invertebrate. They reproduce not reproduce, but they mature in the invertebrate. And then you drink the invertebrate and that begins the cycle again. So the idea is treat the water, right? Filter the water before you drink it, and that stops it. Another disease where eradication is in progress is called yaws. Yaws is rarely fatal, but it's highly disfiguring. So you can get these lesions, you get deformation of the bone, and it's caused by a bacterium that's related to the bacteria that causes syphilis. So they're really closely related. A previous campaign in the 1950s and 60s to eliminate infection dropped cases down significantly from 50 million to 2.5 million. Again, a challenge here is that there are no vaccines, but it is treatable with antibiotics. The problem is it's difficult to get antibiotics to places where this infection is more common. Parts of the world where this infection is common tend to also be parts of the world where there's a lack of healthcare infrastructure. So it's hard to get antibiotics to those places, and it's hard to preserve the antibiotics and keep them in a viable form to get them to the patients. Another eradication program, I guess, in progress is malaria. We'll talk more about malaria later, but these countries here, kind of in orange and red, are countries where malaria is considered to be endemic. Malaria used to be endemic in the US. We used to have lots and lots of malaria in the US. What worked here for us, because we don't have a vaccine, what worked for us is actually getting rid of mosquitoes. So malaria is a disease transmitted by mosquitoes. And so malaria and a couple of other infections, but mostly malaria, are really the reason that most cities and counties have mosquito abatement control groups that go around and like spray for mosquitoes. There are several vaccines in clinical trials, and that could really just make a huge impact worldwide. There are other eradication programs that are beginning, including for things like hookworm, elephantiasis, measles, rubella, river blindness, and mad cow disease in humans. Some diseases that are considered to be eradicated from the US that were previously here include yellow fever. This one's also transmitted by mosquitoes, and so kind of the efforts to get rid of malaria also help to get rid of yellow fever. Of course, smallpox, malaria, polio. We said measles, but then again, maybe not. And diphtheria. So we've managed to eradicate a number of infections from the US, but we're still working to help improve overall worldwide health and to keep diseases from establishing themselves in the country.